Hi, we're going to be talking about mindfulness and mind-body medicine at Bedside. And we're also going to be talking about logistics like scope of practice and charting. So let's get started with why mindfulness at the bedside could be helpful for not just you, but also your patient and altogether the organization. So first, because mindfulness is such a restorative tool, can help to reduce nurse burnout and also emotional exhaustion. When we're dealing with, say, a ratio of one nurse to five patients, that's five different experiences that we have to emotionally process from their stories that they share, the traumas that they have, the hardships of their health challenges. We are present to all of that. So we need to have an outlet for being able to emotionally process and integrate those things. And that's just one day, right? So if we work a full week, we may be seeing more patients with different life experiences, different traumas. So we're still present to all of that. So it's really important that we're able to clear our emotional slate, if you will. And mindfulness and mind body medicine gives us an opportunity to do that so that we can be present and really show up as our best self at the job. Because it can help to reduce nurse burnout and emotional exhaustion, from an organizational perspective, you're going to be able to maintain your staff. It can help to improve patient outcomes and safety. When you're present, you're less likely to make mistakes, make medication errors. You're less likely to forget someone's name. You're going to be present, so you're going to be able to catch these potential errors. It also is incredibly therapeutic. Your presence, that is sometimes the medicine, and that provides for that person, that patient, that healing experience that they need as they move through these health challenges. As far as evidence-based research on mindfulness, it can help to reduce burnout and stress in healthcare workers. It can help to increase self-compassion in as little as 4 to 8 weeks. It can help to improve coping in our nurse administration and in our leaders. And in the ICU, the high acuity setting, it can improve mental health. There's a lot of good reasons why we want to incorporate mindfulness, mind body interventions in these organizations and in our workplaces. There are some barriers to being able to implement mindfulness. First one is time constraints. And sometimes that can be perceived time constraints. For example, if I have 7 patients and I have to chart on all of them in a med surg floor, it's going to be really difficult for me to uh, do some of these mindfulness techniques, not just for them, but maybe even for myself. So we need to develop practical, feasible micro practices, which we'll talk about in the next slide. There's a lack of education, in essence. It's not part of our conventional nursing education. So we're not open and we haven't received the information about how beneficial it could be. Lack of leadership or peer support. Our administration, our leadership, they might not be in tune with the benefits of mindfulness. They might not be educated. And so they might not enforce something as beneficial as mindfulness in the organizational setting. There may also be compassion fatigue or a sense of overwhelm in that nurse. And so all she can do is really practice as safely as possible and focus on the day-to-day tasks versus having an overarching view of mindfulness. That could also be a misunderstanding of scope, which we'll talk about scope of practice in a few more slides. As far as micro practices go, there are many that could be feasible to implement throughout the day. Now, for me, I really had to focus on breath work because I've found that I hold my breath, but also when I get really immersed with my patient, I start to breathe with them and not the other way around. So I end up regulating to them versus them regulating to me. So it's really important that we breathe, we hold our own energetic state, and breath work can help to orient us to present moment awareness. So before maybe you do something like charting, just breathing deeply in and out. Maybe even timing it, something like I'll do a minute of breath work before I chart. Or as I'm charting, I'm going to make sure I'm taking deep breaths in and out. What also could be helpful are grounding techniques before the shift changes. For example, when you're wrapping up with your patients, you are saying goodbye to them, you could be mentally feeling your feet on the floor, feeling your sense of completion for the shift, taking in deep exhalations. You could also use something like chaining, something that you're already doing to incorporate a new mindfulness habit. For example, washing your hands between each patient. That's really common. And so you may want to instill a mindfulness practice. As I wash my hands, I'm going to feel the temperature of the water. I'm going to take in the smell of the soap. I'm going to take in some deep breaths, kind of clear myself before I engage with a new patient. Another technique could be using the 5, 4, 3, 2, 1. When you're entering a new patient room, 5 things you can see, 4 things that you can feel, 3 things that you can hear, 3 things you can touch, 2 things that 5 things that you can see, 4 things that you can hear, 3 things that you can touch, 2 things that might be able, pleasant smells, 2 pleasant smells that you can engage with, and then imagining 1 pleasant taste when you enter into a new room, whatever's feasible for you. You could do some active listening and mindful communication with patients and other staff. These are all micro practices that you can instill in your professional practice at bedside. There are also mind-body tools that you can incorporate in the clinical setting. For example, just breath work. When we're, say, doing a therapy with a patient, like I just remember placing a Foley catheter, and I would tell the patient, okay, I'm going to have you take in some deep breaths. Or if someone was having their bandage removed, taking in an exhalation when I'm taking the bandage off so that they can be primed and their body's able to be prepared. You could also think about body scans. Now, it could just be as simple as a visualization, like you're bringing Mrs. Jones a PRN medication, pain medication. And so you could just guide her in a quick body scan. So from head to toe, can you scan your body for areas that may feel pain? Can you scan your areas for your body for areas that might feel good? You can also consider aromatherapy, and that could be with the permission of the patient. You may invite the patient to bring something that is grounding for them, a certain smell. Or if they like to drink tea, that can be something that they could just use as part of that mindfulness practice. You can also do guided imagery. Guided imagery, especially before surgery, can be helpful for relaxation and healing. You could also do a quick tapping session. So when there's a lot of stress, These 2 points here can be incredibly helpful. And also do gentle acupressure and self-touch. Now, you could teach the client these points where this point here in particular can be incredibly helpful. This point can be helpful if they're feeling tense. So there are points that they can do once they're aware of what they are for that you can incorporate for pain management or relaxation. Now, acupressure may be one of those things that you do have to ask your organization or facility if that's something that you can practice. So these are just some of the ways that we can incorporate mindfulness and mind body techniques in the bedside. So if someone is experiencing anxiety when they're getting a new IV in, you could practice some breath work with them. And we often will do that anyway, right? Like we tell them to take in a deep breath and then exhale, and then the needle goes in. With somebody who's experiencing insomnia, you could do something like a body scan technique. Someone that's experiencing chronic pain, you could have them imagine some kind of grounding, like, oh, when you're feeling relaxed, can you think of a place? Can you think of something that you do? What does that feel like? What does your body feel? And when you are engaging in this, make sure that you are documenting. Patient participated in guided breath work to reduce anxiety. And it's so important too that as you're building up your mindfulness practice, that you do have some peer support, sharing also with the nurse educators, the nurse administration, that this is something that you're wanting to engage in as a culture. You could consider doing mindfulness around break times. You could also invite maybe some continuing education around mindfulness and how to incorporate that at bedside. And by engaging with the benefits, there's going to be reduced turnover, improved morale. The leadership may be more on board with providing these opportunities. Let's talk about scope of practice too, because this is important. Now, I have a private coaching practice, so I kind of fall in a different categories. But if you're working in an organization and also just as a nurse to protect your license, it's really important you know of your scope of practice when it comes to mindfulness and mind body techniques. So within our scope, it's teaching about breath work, teaching about the connection between the mind body, guided imagery, things that are grounding for them, using mindfulness in nurse-patient communication, that is absolutely in your scope of practice. Documenting mind-body interventions. And then if the institution allows, doing group mindfulness sessions. Now, what's outside of scope is performing psychotherapy or trauma work without a license. And we don't diagnose or treat mental illness. So we don't want to use mindfulness and mind body techniques as a standalone in treating, which we don't treat mental illness or mental diagnoses without an interdisciplinary referral. So we want to be mindful that we're not treating mental illness with mindfulness. When you're charting, you're going to use neutral and professional language, like engaged in 5-minute breath work with patient tolerated well. Patient used grounding technique prior to surgical procedure. Nurse facilitated brief guided imagery for anxiety. Now, knowing what you know now, it's really important to incorporate mindfulness, not just as a luxury, but as something that's going to help us sustain our career, sustain our mental health. And really, it's clinical excellence. We have so much good research on how beneficial it is for the patient, for the floor, and for yourself. So I invite you to start to reflect. It's one small shift I can bring into my next shift? How can I model self-care as a nurse, as a leader, as a peer? How can I bring more mindfulness into my daily workflow? I hope that this inspired you to engage in mindfulness, to learn more about it, and I hope that you understand exactly how mindfulness can fit into your clinical practice.